prostaglandin analog, PGE1 analog, or we know as a misoprostol. The commercial name is a cytotric. For the misoprostol, it used to prevent an NSAID-induced gastric ulcer, because we know the prostaglandin or PGE2 is a key ingredient for stimulate the production of the mucus and bicarbonate, and also have the effect to reduce the production of the gastric acid. But it's not only that. Prostaglandin, PGE2 and PGI2, they have the effect on the blood vessel. They can cause the vasodilation, so that increase the blood supply to the epithelial cell. And that epithelial cell, they have the more rapidly or increase the cell growth of the turnover rate. And the warning to use of the PGE analog is not to use around a pregnant animal or even the practitioner, because it can cause an abortion. You have a question at this time? You're curious why is a PGE1? And the one we review it is a PGE2. You curious that? PGE1 analog or misoprostol is the first prostaglandin analog to use in the clinic in human. And for the EP3 receptor, they can work or they can have the signal for both PGE1 and PGE2. And the last class is a cytoprotective agent. And we have two types of agent for this class. First is the sucrose. Sucrose is like a sugar made from the sucrose aluminum hydroxide product. The preparation form, it can be tablet or the suspension. Think about that. Think about the gelatin. Gelatin is just like the dust or the granule, right? And once have the water, they're gonna form like a gelatin base, right? In the same way with the sucrose. Once the sucrose, they in the acid environment, they're gonna become like a viscosity or gelatin, or like becomes like a layer, like a gelatin, and that's gonna protect at the GI ulcer. And that once they bind to the ulcer, it will work like a bandage to the ulcer. That's gonna increase the level of the epidermal growth factor and the mucosal synthesis of the PGE, because this is an increase of the production and gonna trap in the GI ulcer area, because they cannot go to the stomach, right? They cannot go to the stomach lumen. They just stay in the trap in the ulcer. They're gonna accumulate of the prostaglandin and epidermal growth factor, gonna help ulcer healing more rapidly. This agent has a local effect rather than the systemic. So we use just for only the oral administration only. And it's pretty safety for this drug and few side effects. Indication, we use the sucralfate to treat the ulcer. But for prevent the ulcer that from the NSAID is still questionable. And the drug, they need an acid environment to become like a gelatin form. So you need to give the dose at least 1 hour before the H2 antagonist or antacid. Because when you use the H2 antagonist or antacid, gastric acid gonna be less production, the pH gonna be increased, and sucralfate cannot become gelatin. The sucralfate has a drug interaction because they have like the cover on the ulcer gonna be interfere with the absorption for other drugs. And because the drug is have the aluminum sulfate, is a heavy metal, and heavy metal can have the chelate effect for this drug, and these drugs are the fluoroquinolone, digoxin, and the tetracycline. Yes.
Does this one have a short half-life? Or I guess I'm just asking about the hour before we give the H2 antagonists or antacids. So does it work relatively fast?
They work very fast, and they have the short half-life. They don't have the half-life in terms of the excretion, something like that, but they have the half-life for the action. And once they have the acid environment, they're gonna stay there. They're gonna have the action for that. And once the stomach increase the gastric secretion, the sucralfate gonna fade away. So we have to repeat the dose. Yeah. And some of the agents, like a fat soluble vitamin, they absorb in the stomach, so that can be interfere once you use the sucralfate. The last one is a cytoprotective agent, is an antacid, or we know as a term or in the commercial, like when you have the food or the spicy food and you have the heartburn and stuff like that, yeah. And this is we can know as a neutralized gastric acid. It's the best drug, it's the best agent. Aluminum hydroxide, magnesium hydroxide, calcium carbonate. It's not only neutralize the gastric acid, it's also inactivate the pepsin or the bile salt. Because the pepsin and the bile salt can cause a gastric ulcer too. Used for treatment for the ulcer, but the adverse effect for this one is the constipation, especially for the calcium carbonate. Bless you. This drug is very safe and not drug interaction in terms of the pharmacokinetics something, but because it reduces it will increase the pH in the stomach. And the drug that need the gastric environment to absorb the drug, that can be effective to use the antacids. And the same as the sucralfate, because they have the heavy metal, aluminum, magnesium, calcium, they can chelate the other drug. And that drug, digoxin, tetracycline, fluoroquinolone, and the drug can be less absorbed and cannot be effective in the body. This summarizes everything I'm talking about, and it pulled out from the human pharmacology. And you can see they have the Helicobacter pylori, but we study a lot about the Helicobacter bacteria that can cause a gastric ulcer. But in animal, we still questionable. We cannot have the conclusive result. The Helicobacter can cause the ulcer or not. So, any question for that and make you sleep already? I know 3 hours is long, and you just Monday after the long weekend. Yeah. We finish 5 minutes earlier. It's weird. No, we cannot finish the time. Any question? Okay. If you have a question, you can ask me by the email or the help section. And again, help section for this week, I'm gonna review just short review for the NSAID and antihistamine. Just 30 minutes, something like 30 to 40 minutes. Yeah, depending you have how much question for that. And that are gonna be like an open question about anything is not related to the review or anything to this for this.